Good evening and welcome at a new edition of our broadcast. Psychosocial aspects are interacting factors that impact general functioning by shaping individual behavioral tendencies. Understanding the complex relations between these elements represents a premise for developing and applying client-centered psychological approaches. By adjusting such interventions to the particularities of each person can significantly improve treatment adherence, motivation to engage in healthy lifestyle changes, and ultimately well-being levels on the long run. It's a great honor to discuss all these aspects today with Dr. Jeremy Wente, professor at the Department of Social and Behavioral Sciences of Southwestern Christian University from Oklahoma, United States of America. Dr. Wente teaches several disciplines, including foundations of social work, crisis interventions, cultural competencies, social policy, history and theories of psychology and counseling, as well as other subjects. Dr. Wente, thank you very much for accepting our invitation.
Thank you for having me.
I know some of your major research interests relate to clinical social work and the prevention of discrimination in mental health practice. So, therefore, the first question would be, how can the application of psychosocial principles inform clinical practice, specifically psychotherapy?
Let me talk just first about a little bit about my research and focus in my doctorate.
Great.
So it's contexted in specifically in the United States, related to racial disparities, which relate to more broadly like systemic factors that impact whether a person seeks mental health treatment or not. And so that is really connected to this idea within social work, and the psychosocial focus is we are impacted by the environments around us. So specifically, when we look at a specific theory called ecological systems theory, which is one of the grounding theories within social work, impacts social work practice, all kinds of practice, but specifically within the clinical setting, mental health setting. So the systemic viewpoint is a part of assessment. So when we think about the process of somebody walks into your office and they have a need, they are dealing with some type of mental health struggle. And so we start with an assessment. And that's just kind of the basic, that's the basic thing that we do as clinicians. So it would be a biopsychosocial assessment. So we take in consideration potential biological factors for what their complaints are, or what their needs are. And then from that assessment, we would also look at psychological and social factors. And so how is the way they're thinking about their situation impacting them, but also their environment. And so ecological systems theory considers the individual in the context of a larger environment. So we have a individual, let's say a child who is born into a family. And so that family would be the microsystem, and they would impact the way that child grows up, is socialized, understands the world around them, develops coping skills. But then they also are impacted by another system, and then a macro system, which would be things like policy. It could be as broad as a governmental policy that directly impacts this person. It could be environment where there is discrimination, maybe, and how that discrimination impacts that child that person in that environment.
Mm-hmm.
So when we're talking about assessment, which is, the kind of the core of when you're working with somebody when they come into your office or whatever your environment looks like, we have to consider through that assessment the biological, the psychological, and the social. So considering kind of a holistic viewpoint, um, and hopefully, there is a time and place where we had this focus on the medical model, which
Mm-hmm.
is often more biological. So it's somebody comes in with a symptom, we look at the symptom and we assess it and we treat it through medication, whatever, like more of a biological focus. And this is more broad
Mm-hmm.
to say that there's more going on with every individual, whatever the symptom might be, if it's mental health, that we would take in consideration the social environment as well. A couple other grounding theories that really ground social work. Social work, clinical social work will draw from all of the theories that are out there. So a clinical social worker might do cognitive behavioral therapy with a client, but they also would look at things from a specific viewpoint. So, for example, one of the most influential pieces, if you think about a development of a psychological theory, counseling theory, is the humanistic viewpoint. So we have psychoanalytic, behavioral, and then humanistic. And so within the humanistic theories, we have client-centered or person-centered therapy. And this is really, for social workers, it's one of the grounding theories. So just as a general, like it would take a long time to talk about, all the details, but it's understanding that when people have a struggle,
Mm-hmm.
a symptom, often those symptoms are impacted by the environments they're around them. So what we might say is a lot of our environments are not therapeutic.
Mm-hmm.
They don't lead to healthy mental health. So one of the things a clinician is trying to do is to create a healthy environment. So when they come to your office or you're out in the community, one of your task is to try to create an environment where it's therapeutic, where they feel unconditionally regarded as an individual, respected. Um, and so the environment is very important. So
Mm-hmm.
as a clinician, I would want to look at where I do my counseling, look at the actual physical location, the space that I provide for that person, and then also respond to them in a therapeutic manner. And so even with this has been used a lot with clients that are not necessarily don't necessarily want to be in your office. So for example, with court ordered persons or people that are they like to say they don't want to be in counseling, but the court says you have to, which leads us into another related theory, which is motivational interviewing. Motivational interviewing would look at change, the motivation for change for that person, and
Mm-hmm.
be willing to work with that person who comes in and says, I don't want to be here, or I don't have a problem. A lot of the early research in motivational interviewing was with people suffering with substance abuse disorders, people that are court ordered, don't want to be there. And so the idea is that you would provide the type of environment that would motivate that client eventually to start to make change. Um, Motivational interviewing is really become started out in substance abuse, and it's really been broadened to focus on lots of types of practice. And so the most recent, I can't remember the name of the text, but the most recent textbook also includes the medical setting, encouraging physicians and other practitioners to use some of the skills within motivational interviewing. So hopefully that gives you kind of a synopsis, I don't know if that was short, but some type of synopsis of a social work viewpoint.
Yes, this is very, very interesting, the way the context can actually influence behavior. And we know learning mechanisms are actually very important in psychological research, a very frequently found topic in research papers. So we know that this relates a lot to our social context. For example, social learning and modeling are important processes. So how do you think these processes can inform or can help us understand our day-to-day functioning, actually?
Yeah. I think we've all asked ourselves, why do we do what we do? Why do we respond to stress, respond to frustration? Why do we respond the way that we do? That's probably a question that everyone asks. And a lot of times, for ourselves, but also for the people that we work with, they're going to be coming in asking similar questions. And so being informed about the social learning as a really important piece of how we learn coping. So one example might be you grow up in a home, and one of the ways of coping is through violent behavior. Maybe you have a parent who, when they get frustrated, they throw things, or they end up hitting a child or a parent, a mom. And so what might happen, there's not necessarily a direct correlation between observing behavior and repeating it, but what might happen is that child might also learn those same coping mechanisms. So when they get frustrated, they would go to what they have observed, the models in their home that they've observed. And so for our clients, but also for ourselves, to start to answer those questions as, why do I do what I do, is to look back at our own socialization through our families, the models we've grown up with, or even the environments we've lived in. And so even living in maybe there's a neighborhood that there's lots of crime or lots of violence, and that person who grows up in that neighborhood also participates in crime and violence. And so we can look back, and it doesn't describe the whole situation, but a piece of it is social learning. And so the next piece of that is motivation, or not reinforcement is a better word. So we might behave in a way that's not a good coping mechanism, but our environments might reinforce negative behavior. So maybe you live on that neighborhood where there's a gang. I don't know if that's context of the United States, but I don't know if that's common. There might be a gang. And so you grow up in that neighborhood, and you actually get reinforcements to participate in criminal behavior. And so it's social learning from our primary environments, our caregivers, but then it's also potential larger environments that reinforce negative coping skills. Yeah. And so again, why do we do what we do? I would say there's not a simple answer to that, but one piece of the puzzle might be our social environments, and learning through modeling, learning through observation.
Yes, so we talk about many applications of learning processes, especially when we build some behaviors and habits, and this can go in both directions, if I understood correctly. So they can be functional or dysfunctional. So positive or negative, and we know that a frequent negative consequence of learning processes is known as learned helplessness. So, what are the main implications of this process in emotional disorders, especially major depressive disorder?
Yeah. So one of the key factors of learned helplessness is this aspect of control, where we find our power or our control. So, for example, you have external locus of control and an internal locus of control. So somebody who has an external locus of control really believes that the outside environment impacts who they are, and so the more times you might experience a out of control situation or a perception that you don't have control, the more likely that you might start to believe that you lack control. You lack the ability to make decisions about your behavior or decisions about your feelings, emotions, and so can lead to this sense of learned helplessness. And so there might be some truth to external locus of control. For example, we can't control the weather. And so let's say you have a bad storm, you have a hurricane, you have earthquake, and it impacts your environment. So you might actually lose family members because of that experience. And so there is some truth to, there are some things we can't control. So some of that is reality, but it's when this starts to impact your perception that there's nothing that I can control, and you actually start to, I guess, lose hope or lose motivation to actually make change. And so something like major depression, it might actually be, it could be biological, but it also could be impacted by our environments. And so we might experience multiple things throughout our life where we don't have control. We might lose a job. We might lose a family member. We might have early trauma that we can't control. And then we have emotions or we have feelings of depression, might be diagnosable. When something actually happens, for example, that you can control, I can choose to go to bed early. I can choose to eat better food, or I can choose to move my body and go exercise. These are all known to help with depressive emotions. I can also think about my thought processes. So how do I think about the environments around me? Is there I guess distorted thinking or cognitive distortions? These are things that we can work on with a counselor. We can work on our own. But learned helplessness says even those little things like getting out of bed or choosing my diet, I just give up motivation. So if you could imagine somebody who has that viewpoint that they've developed this cognitive distortion, they have this circular thinking where it says, I'm not good, the world's not good, good things are not going to happen. It's hard to move out of that type of triad Beck would call it triad thinking. Um, Hopefully that answers your question.
Mm-hmm. Yes, yes. So very interesting the fact that a person can perceive this situation like losing reinforcements from the environment actually, and this is related to learned helplessness. And another related phenomenon is the benefit of the symptom actually. And we know this can have implications both for psychopathology but also for chronic medical conditions. So, how can we understand all these medical conditions or psychiatric conditions, emotional disorders, through this framework of the benefit of the symptom?
Yeah. So again, I like to start with questions that we might think about in our own family system. And so imagine in the context that I kind of come to this question is with substance abuse or alcoholism. Imagine that you grew up in a family and your father is an alcoholic. And so your father's one of his primary ways of coping is to drink alcohol. This impacts the whole family. Everyone in that family knows that dad's an alcoholic. This benefit of the symptom, the way that I understand this concept, is that we work as a family and unconsciously to keep dad sick. And so one of dad's roles in that system is his illness or his alcohol use. It doesn't make sense when we think about it logically. Why would we want to keep somebody in our family sick? Why would we want to behave in ways that maintain that illness? So that's a very psychological. We might have different ways of thinking about that. Family systems would say that our family system has been developed with different types of roles. And so someone might be a caregiver for dad. You could replace this with a chronic condition. You could replace the issue or the need with a chronic condition. Maybe somebody has a chronic pain disorder and it impacts them, but it also impacts everyone else in that system. And so there might be somebody whose primary role is caregiver. And so they spend most of their time caring for the person who's sick. Unconsciously, that might be the role that they don't want to let go of. So it might be that they are, for the alcoholic, it might be that they are covering up the behavior of the alcoholic. That's one of their primary roles, is to care for that person. And they actually develop this identity as the caregiver in the family system. You might have others in the family that are scapegoats or people that are blamed for bad stuff. So one of the things I like to say to students is when you see a child, and there might be disagreements with this statement, but when you have a child walk into your office, they are often a symptom of the larger family system. So a child who's having disruptive behaviors, getting kicked out of school, whatever the behavior is often responding to the family system. And sometimes it's easier, more comfortable to address our children's needs than it is to address maybe even the alcoholic in the home. So you might have a child who's acting out or creating disruption at school or wherever, and then you take them to counseling or you try to get them help when dad is still being drinking every night and being disruptive. But it's easier to address the child's issues. So everything's connected. And so when you think about, we all are responding to our primary socialization through our family, but we are also responding to larger factors in the environment. Um, so, again, goes back to, why would somebody, what's the motivation or the benefit of remaining ill or staying sick? It's complicated, but it's often related to our symptoms and our we tend to go with the path of least resistance often. So change is very difficult. So focusing, if dad gets healthy, or if that person in your house who has a chronic condition starts to feel better, it actually changes the whole system. And so everyone has to adjust to the change. You might actually have to start, let's say it's a married couple, then you might have to start focusing on the relationship in the marriage. It's easier to keep somebody sick than it is to focus on, okay, we have some marriage troubles. Or if you have a child who's acting out, it's often easier to focus on that child's issues than it is to focus on the other things going on in the family. So hopefully that helps answer that question.
Yes, this is very interesting, and we are actually part of a system. We go back to that idea and the fact that all our behaviors actually serve a function. So I think this is the main point.
One of the statements that's made is all behavior is purposeful.
Exactly.
So every behavior is trying to achieve something. There's a motivation behind all behaviors. Often these are unconscious, so we don't necessarily know our motivation. But trying to get our needs met.
Yes.
Basically.
Right. Okay, Dr. Wente, given your future teaching activity at the future study program in psychology of our university, I would like to invite you now to share some thoughts for our future students. So what do you think they should learn about the applications of such psychosocial processes in their future practice?
Yeah. Good clinical practice starts with a foundation of good assessment. So when we think about the process of assessment, diagnosis, and treatment is kind of the process that we do. If we aren't looking at the whole person, the holistic picture, to understand what somebody's experiencing, we might be missing something. And so the other side of that is incorrect or incomplete diagnosis and incomplete treatment can all go back to a incomplete or not well thought out assessment. So from my understanding, my philosophical understanding is that we need the holistic picture. Not some things are biological, some things are cognitive or psychological, the way that we think, maybe even biological and psychological combined with brain chemistry and things like that. But often the social is also very important. So if we ignore in our assessment the social environment, we are missing a piece of the puzzle, a piece of that assessment. And so I think it all starts with a grounded assessment, which includes the biological, psychological, social factors. So we're complex creatures. We're complex beings. And so holistic assessment helps us come to a better diagnosis, a better treatment outcome. And then the other thing is to really, a part of like the humanistic wave of counseling is to also the focus on the self as the counselor or as the clinician. When I work with somebody, I bring myself into that practice. I am also present. And so it's not just the client who we're trying to help. We are actually present with that person and trying to create what I talked about earlier was a therapeutic environment. And so, that involves ourself. How do we listen? Working on empathy. Empathy, these seem very simple, how to listen to somebody and understand what they're saying, but it actually can be very complex because we often don't, when we think about miscommunications, those often stem from lack of listening. And so learning to listen, learning to be empathetic towards people that we may not be natural. And so we often start with judgment before we step back and try to really understand. And then also self-awareness. So am I congruent? When I say I feel a certain way, do I behave in a way that's congruent? And then also the environment is not only just me being present and being aware of the other person in the room or family in the room, but it's also the physical environment. So thinking about how space is important, the way the room looks, the comfort, if we're working with children, having age appropriate toys, these seem very simple, but it's often we can ignore those things, and actually it is a way of communication. So the more we attend to the environment, the more we're communicating to the people we're working with that we are ready to listen, that we care, that we understand their needs.
It's very important and very beautifully said. Thank you very much for this captivating discussion. And thank you very much for watching us. Have a nice evening.